In the world of healthcare, there are four basic models used. First is the Beveridge model, named after William Beveridge, the social reformer who designed Britain's National Health Service. In this system, healthcare is provided and financed by the government through tax payments, just like the police force or the public library. Many, but not all, hospitals and clinics are owned by the government. Some doctors are government employees, but there are also private doctors who collect their fees from the government. In countries that practice this model, you never get a doctor bill. These systems tend to have low costs per capita because the government, as the sole payer, controls what doctors can do and what they can charge. This model is used in Cuba, and although free healthcare is advertised as being excellent, most of these facilities are filthy and patients have to bring their own bed sheets, otherwise they have to lie down on a dirty and bare mattress. The second model used is the Bismarck model, named for the Prussian Chancellor Otto von Bismarck, who invented the welfare state as part of the unification of Germany in the 19th century. It uses an insurance system. The insurers are called sickness funds, usually financed jointly by employers and employees through payroll deduction. Unlike the U.S. insurance industry, Bismarck-type health insurance plans have to cover everyone, and they don't make a profit. Doctors and hospitals tend to be private in these countries. In France, primary health care is provided by a network of 23,000 general practitioners that are mostly self-employed, working either on their own or in group practices. Most of the cost of a doctor's visit will automatically be reimbursed to the patient by his state-run health insurance provider. France has been rated the most efficient and functional system by the World Health Organization. Third is the National Health Insurance Model. This system has elements of both Beveridge and Bismarck. It uses private sector providers, but payment comes from a government-run insurance program that every citizen pays into. Since there's no need for marketing, no financial motive to deny claims, and no profit, these universal insurance programs tend to be cheaper and much simpler administratively than American-style for-profit insurance. Canada's healthcare system is a group of socialized healthcare insurance plans that provide coverage to all Canadian citizens. It is publicly funded and administered on a provincial or territorial basis within guidelines set by the federal government. With a few exceptions, all citizens qualify for health coverage regardless of medical history, personal income, or standard of living. Lastly, we have the out-of-pocket model. Most of the nations on the planet are too poor and too disorganized to provide any kind of mass medical care. The basic rule in such countries is that the rich get medical care and the poor stay sick or die. These models should all sound very familiar to Americans, as we have a messy combination of all four, depending on your income and social standing. In 2010, Patient Protection and Affordable Care Act, also known as Obamacare, was passed, with hopes to increase access to care while also reducing spending in regards to health care. The Affordable Care Act requires all insurance plans to cover 10 essential health benefits, including treatment for mental health, addiction, and chronic diseases. Insurance companies can also no longer deny anyone coverage for pre-existing conditions, drop them, or raise premiums once they do get sick. Parents can also add their children up to age 26 on their health insurance plans. The Affordable Care Act expands Medicaid eligibility to 138% of the federal poverty level, providing this coverage to adults without children for the first time. It also provides tax credits for insurance to the middle class, 400% of the poverty level. However, for working Americans, health insurance companies canceled plans for 1 million people because they didn't comply with the Affordable Care Act 10 essential health care benefits. Also, between 3 and 5 million people could lose their company-sponsored healthcare plans, as many businesses find it more cost-effective to pay the penalty and let their employees purchase their insurance plans on their own. For Medicare patients, they are experiencing a lot of budget cuts for important things such as end-of-life counseling. For providers, the ACA also changes how Medicare reimburses hospitals. It is going from a fee-for-service to value-based payment. Instead of being paid for every test, exam, and procedures, hospital and doctors will be paid based on how well the patient does after treatment. Higher income families and uninsured Americans, usually those who fall just above the 138% cutoff but still can't afford insurance, have to pay higher taxes. Choices are also limited to in-state providers, and providers can also charge different people different prices for the same services. The Affordable Care Act was a hot topic for this year's election as President Trump promised to repeal the act. This would affect lower and middle income Americans who use federal subsidies to afford premiums the most. However, President Trump will keep young people insured by their parents until the age of 26 and also plans to cover those with pre-existing conditions. Among many other things, he also plans to give block grants for Medicaid to individual states. Seeing as the Affordable Care Act has now been in place for several years, many people are now reliant on it, and it should not be repealed but in fact revised. Something like the sickness fund seen in the Bismarck model could be adjusted for the size of our country and be perhaps implemented. Medications and healthcare are so advanced in the United States, you should not be denied access to basic healthcare because of your income.